Well, my name is Eduardo Macias, and I'm a pediatric cardiologist, and I'm also the director of fetal cardiology. Cardiology is a very interesting field because it combines what I think is like the engineering part of medicine. It's very logical, and before I wanted to become a doctor, I wanted to become an engineer, and so that part about cardiology I loved. But also the fact that you get to follow, in my case, a patient since before they're born until adulthood. And that gives you a chance to meet them and develop relationships with them. I get to develop very close relationships with them in very hard conditions when they're very sick. And but also I get to see very happy patients, successful stories. The other thing that really makes me passionate is serving the underserved. Even before I went into medical school, I started a free clinic, and I try to develop that passion for providing care to those who do not have the access to it. I grew up in the border between Mexico and the United States, and that population has been classically underserved. And that has been one of my passions, to serve them and provide them excellent care. Being a new mom with a new diagnosis of a cardiac condition, I know can be very difficult. So one of the things that I like to do with my patients is to get them in contact with a lot of the resources that we have at our clinic. But not only that, we try to set several visits before before the baby is born, and in those times we get to explain what you should expect throughout pregnancy, delivery, what are going to be the consequences of the condition that your baby has. I think educating patients on their specific cardiac lesions is incredibly important. When moms know their diagnosis, they know what to expect. It's been studied that their anxiety levels come down. They're able to prepare better for the baby, and their adaptation to having a baby with this condition is much better. My favorite thing about my job are my patients. I like to interact with moms and also with kids. I think I have my kids would tell me that I have a very goofy personality, so I like to interact with my kid patients. But at the same time, just going to my clinic and meeting new people and having that experience of interacting with people. That's what I like the most about my job.